So in this video, we're going to talk about working through the cranial sutures. And so why would somebody need to work on the cranial sutures? For a number of reasons. Sometimes if people have a direct blow to the head, if they have a fall on their head, if they have a lot of headaches, this is a great place to work. The fascia around the skull and the cranium can just get a little bit bogged down. And so, in school we learned that the cranial bones are fused, but there's some schools of thought that potentially they're not completely entirely fused. And so maybe there's some type of movement. And so where you have the fusion happening of the bones over time, or if they are fusing over time, that is kind of a place that fascia can get bogged down and adhered. And so what we're going to do is work through the different cranial sutures in this video. And so we will start kind of front to back. We'll start first with the coronal suture. And so on this skull, it's nice, it's color coordinated, it's easier to see, but where the blue and the green meet is the coronal suture. And it's easy just to find at the top here because there's kind of a bigger bony prominence that you can find, and you can follow it down, and it goes down to around right in front of the temple. And so again, you can work all along here. What I try to do is find the suture, and I rub back and forth, and I try to assess, can the fascia move forwards, backwards, up and down? Use your FM1 principles to try and find the area of restriction, and then you can use some of your cascades of techniques and some FMs to work through that. So in this first part, we'll do the coronal suture first. And so the way that I find it is to come to the middle along more like the mid-sagittal suture and come around until I feel like I find a prominence of where the frontal bone meets the middle of the skull, and that's about right here on Juliana. Usually some people, it depends on how big their skulls are, but people sometimes have a wider frontal bone than others. So kind of follow down middle of it and you'll come to this big bony prominence. And I can go across, and the suture's going to come kind of down and forward. And so if I imagine where that is in my mind as I come across, I can just assess, is there movement at this suture. And so if I find an area of restriction, I'm going up and down with her. I can go side to side. I can check on different diagonals, like right through here. That feels a little bit restricted here. And I can just hold the pressure there. I can use my other assisting hand to lengthen or shorten around. Hard to do unlocking spiral in here, but you could if you wanted to. I can use some FMs. I can have her gently raise your eyebrows until you feel tension into my finger. Hold and let it go. Good. And then I can continue to further localize. Raise your eyebrows gently. Hold and let it go. I can also use my other hand to kind of wind up, side bend right, side bend left, side bend right, winds up a little bit more. I can add a little rotation, see if that puts more tension in. And then if it's side bend right, I can resist further. I can resist her side bending left. So pull your left ear down into my finger. That loads right into my finger. So those are some of the FMs you have for the coronal suture. The next suture that we're going to go through is the mid-sagittal suture. And so it's right through the midline of the skull, and it goes all the way down to the base, to the top of the occiput. And that blends in with the Lambdoid suture. And so for this one, again, going kind of across the suture, can I go side to side? Can I go up and down? Find an area of restriction. And then your FMs are going to be relatively the same. So I can start frontal bone, find coronal suture, and then if I stay just behind it, I can follow mid-sagittal suture. And there's some restriction more going to the left on Juliana, so I can come here. I can do same cascade of techniques. I can have her raise her eyebrows up gently, see if that pulls into my finger. I can wind up through side flexion of her head. Maybe a little bit of, sometimes you can even resist some little extension, so hold there, don't let me pull up, and that localizes into my finger. Even just breathing into my fingers can be another way to get some FM into that area. So that can be a way that you work through mid-sagittal suture. The next one we'll talk about is going to be the parietal suture. And so you follow down, the way I find this is find the coronal suture, follow down to around the temple, and then come around the ear. And again, you can do the same thing. Find that suture line. It'll feel bumpy when you're doing this. It takes some practice to try and find the sutures, but you'll be able to find them with practice. Keep your hands soft so that way you're not pressing aggressively, because then it's harder to find it, because then you blow past some of the lighter receptors in your fingers when you're palpating. And so again, start frontal bone, come back, find the top of the coronal suture, can follow that suture down into temporal bone, and then I can come around her ear, and there's her parietal suture. And it runs back and around and connects to lambdoid suture as well, to the occipital bone. So very similar things here. Kind of strum it, see where there's any restriction. Hers actually feels pretty good, but if I found a restriction, I could wind up again through side flexion, towards or away. Even a little rotation might put it there, and then resist. Don't let me pull your left ear up. And that can connect into your finger. The shrugging of the forehead or the eyebrows doesn't work as well here, but it possibly could. You could have someone open and close their jaw, tongue the roof of your mouth to stabilize it, and that might pull into the suture as well. It's just another way to get some FM to there. And then the last one we're gonna do is the lambdoid suture, okay? And so it's above the occiput, which is this brown bone here. The way that I find it is I do the same every time. I come down, find the coronal suture, follow the mid-sagittal suture all the way around until you feel like you hit that external occipital protuberance pretty much right above it. And then that suture follows all the way down through the occiput. And you can work on both sides. This is a big area of tension, especially forward head people or people that don't have good OA extension. Everything just gets bogged down here. Think of your chronic headaches, especially the behind the eye headaches, because it's close in relation to fascial connections to the suboccipital muscles. So I'm going to rotate Juliana's head a little bit so that you can see, but I'm going to start from the forehead, find coronal suture right here, follow sagittal suture back, and then her occipital bone right at the top of it here, and there's her lambdoid suture. She's got a little tenderness and restriction probably through here, and so it's more this direction up towards her more superior, and then I can find further localized. It's superior and a little bit, I would say if I was on a clock face and up was 12 o'clock, more like 1:30, we'll say, 1 or 2. And then from here, again, I can have her do just some breathing. I can hold pressure with my finger. I can further localize with CV, flexion, extension. Flexion brings it into my finger a little bit more. And then I can resist a little bit. I'm going to switch her back to more here. And then I'm going to say, don't let me lift your chin up, so I can have her resist, do a little kind of a axial elongation to my finger. That's one way to do it. I can resist some side bending as well through the ear. Plenty of options to do. You can also, I didn't do it in this video, but you could think about lower trunk rotation. It's far away, but somebody might have a fascial restriction from there that you're missing. So just check everything. But that is how you work through the cranial sutures, all of them. And again, the reasons you'd want to go here would be concussion, trauma, direct blow to the head, or headaches, people with neck pain, even people that have heightened nervous systems. This can be very calming to them. So yeah, I hope this video was helpful.